August the 4th was the date of the Beirut explosion, which killed over 200 people and left 6,000 injured and many, many more missing. The 11 emergency medical teams flown in from other countries to help in the wake of the massive explosion are now turning their sights and their efforts to COVID and supporting, people in Lebanon and the healthcare systems to deal with them. The WHO has deployed 25 tonnes of personal protective equipment to Beirut to support the ongoing response to COVID-19, as well as medical supplies to 2,000 people after the disaster. I think it's really important to share with you, though, that in the face of disaster, it's important to acknowledge the unprecedented resilience of people in Beirut and in Lebanon as they work to get their lives back together. And this is not an unusual comment to make in both natural and man-made disasters. The resilience of all people and older people in particular is really at the forefront, often before, the emergency services kick in. Today, we have the great pleasure to be in conversation with someone who has been really at the heart of humanitarian responses for many years. Samina Gul, Regional Head of Programs at HelpAge International, Eurasia and Middle East. She manages a portfolio which I think is just overwhelming to me. In the Middle East, Yemen, Syria, occupied Palestinian territory, Lebanon, Jordan, and in East Europe and Central Asia. As I said, this is not an unusual topic for Samina. Just as we came on to the call today, Samina said that she has worked and lived in Pakistan, in London, Indonesia, East Africa, Sudan, Iraq, Ethiopia, and now she comes to us this morning from Jordan. It's a great pleasure, Samina, to be in conversation with you this morning, so I hand the floor over to you.
Thank you very much, Dr. Jane Barrett, for this opportunity and for this humbling introduction. I feel very humbled, amongst all of you who are experts and on the issue of aging and know a lot more than I do. I think the only advantage that I would say I have is, coming from the field and sharing some field experiences with you all. And I hope we can generate some discussion and debate and follow up to that. So I'll start very briefly. I mean, you have already mentioned the introduction, in your introduction, the situation in Beirut. But I do want to actually mention a bit broadly the situation in Middle East, the context that we work in. Majority of the countries that we work in are experiencing either an ongoing conflict or a conflict that has been going on for years. It's a protracted conflict that is there. Alongside with that, there are economic difficulties. There is instability. There is no civil society movement there. Governments lack political will as well to do anything about it. And with all this going on, there was, on top of all this, COVID-19 hit. So governments and service providers who were already quite weak to respond to any needs of older people or people with other vulnerabilities were further stretched. So the context itself says a lot when we mention the names Syria, Yemen, OPT, Iraq, that just anybody listening to those names know what is going on there. They have fairly good idea. The news since last year have been going through this difficult situation with their political situation, the social situation, the economic situation. Since October last year, there is unrest in the country and demand for the governments to leave and have new elections, etc. So within all this stability, the explosion happened. Before that, COVID had already happened and the health systems were completely incapable of responding to the needs of people affected. So they put in place a lot of, lockdowns, which sometimes were respected, sometimes not respected. But the effort was to reduce the burden on hospitals. And with this, the key thing that we want to look at is people were already suffering from COVID, from the banking system, from the inflation, from the lack of, any facilities to them, the power cuts. We are working with our colleagues in Lebanon, and there are power cuts all the time. And, amidst all this, we find out, okay, there are about 180 people who lost their life, 6,000 people, affected or injured, 3,000 households severely damaged, and the health system, as Dr. Jain mentioned, is also hugely affected. So it is a catastrophe within a catastrophe. But one thing that is really, really important to note is that people have not given up. People have risen and immediately started working on the response there. In every emergency that I have experienced, the first responders are the people, common people, who are themselves affected. They come out and they respond, whether they help, in any way clearing the debris or giving out food or water or whatever. So while there is this catastrophe, there is a bit of hope there as well, which keeps us going. I will briefly mention what we as HelpAge did in all of this situation. We are a very small team in Lebanon working on non-communicable diseases with public health centers through local NGOs. And within that context, we felt that it is extremely important that we have a sense. Of course, we were hearing the news, but we wanted to have a sense of what exactly is happening on the ground, how are all the people affected, and what are their needs. And we joined hands with other organizations, local organizations, international organizations, and conducted a needs assessment. And that needs assessment, which was turned around in 3 days, along with the report that we shared with everybody, and I can share the link later on with you all also. It highlighted what are the real needs on the ground. And without going into too much detail, briefly it talked about, access to health services, medicines, food, even cooked food in the immediate days, and cash primarily because everybody really needed to repair their households. That report, I think, covers a good ground on what really is required immediately, which we have shared widely with the clusters and other agencies, and we'll be happy to share with you also. I want to go a bit deeper in terms of the impact all of this had and when I say all of this, this means COVID-19, the pre-existing emergency, and then the Lebanon emergency. And a lot of this is also common in other Middle East countries as well in terms of the impact that all the people have. I think first and foremost is the movement restrictions within the COVID situation, and then also because the Lebanon situation was already really bad with the COVID-19, and they were about to actually institute another lockdown on Wednesday, while on Tuesday this blast happened. And so with all that happening and movement restrictions, people forgot that there are older people, people with disabilities, people who have limited mobility, who cannot go out. And then the government regulation that said that 50+ people are advised to stay home. So the immediate effect was they missed out on their doses for their non-communicable diseases, for diabetes, for hypertension. They had no access for anything else that they were feeling health-wise to the public health centers. They did not have their medicine. They could not get their food and basic necessities for themselves. because of the restrictions. So while the restriction was for and their benefit, the proportion in which it happens and how it is done is very important. The second point that I want to mention is that was highlighted was, the accessing pension. So in countries where there was a possibility of getting pension, when everything was closed from banks to the pension offices, there was no way anybody was going to have access to the pension. In a lot of cases, people were not prepared for the lockdown, and when it happened, they didn't have anything at home. Another barrier to access in the case of Lebanon, for example, is so many of health services are damaged that people don't know where to go. And whichever systems are still working are overwhelmed. So that has created another barrier in terms of accessing the health services. Then the other very important element within all this is also the lack of information on COVID-19. Because let's remember, we are dealing with a couple of emergencies here now. The pandemic, which was there, and which is getting really bad in Lebanon's case, and then also the blast emergency. So, it's a lot of confusion how to do all this and how to manage. One other issue that we came across in our needs assessment that we conducted for COVID-19 and the recent emergency was the mental health issue. A lot of older people said to us, we really don't know how to survive this. Some of them were sitting outside their broken houses and their damaged houses and wondering how will they spend the night. They are alone, who will rebuild their house. So there was a lot of mental stress that they expressed, and they were worried about it. They actually mentioned it to us in our needs assessment that they are very concerned about this. And they also lost access to the community spaces that they used to visit. Even amidst COVID-19 with all the preventive measures, the masks and everything. But there was a space where they went and they spoke to each other and they talked to each other. They were not lonely. And that whole system, was dismantled as well. So it was an emergency on top of emergency. A couple of other things that we noticed, and some of this is anecdotal, some of them is the information we received through the hotlines that were set up by our partners, is a lot of protection risk. So people sitting outside their houses, they're afraid that the house is not in a condition now to move inside. And so sitting outside is a risk in itself at night, etc. So that was also considered, like, people outside, who knows what happens to them. And things did happen. There were people who pretended to be volunteers and who came, and actually there are reports of thefts. There are also reports of people offering the older people to sell their houses, telling them, it is now in such a bad shape, you won't get a good price later on, so sell it to us. So that is the kind of exploitation that has taken place. It's amazing that in all this emergency, people can still think of such things. But it has scared people, and it has created this protection issue. Then there are also many people who have their income sources damaged. So many older people, I'm happy to say, they are not only victims, they actually contribute in their work as well. And their sources of income were damaged. So, we have case studies, a barber shop or a supermarket that they have no money now. They don't really know where to begin and how to rebuild that. So their immediate source of income is completely lost. They don't know how to feed their families. Many older people are unaware of services provided in the area, and they lack information on where to get assistance. So that is, when emergency happens, yes, we take care of the immediate things, but it is very difficult to know, who is the service provider, who we can call, which numbers are available for a particular emergency, who is there to help. So they lack the basic information on the service provision and possible assistance as well. The one very important thing that I want to mention is also around older women and people with disabilities. They are not even being talked about. Apart from some humanitarian organizations talking about it, I think they're just forgotten in the discourse. They are nowhere to be seen in that discourse. And the specific needs that they have, they fall in cracks or are just overlooked in the bigger scheme of things. So it's very important to make sure that we keep bringing those elements. So these are very broadly some of the things that we experience from our first-hand information that we have, the needs assessment we conducted. I will now move on a bit to the humanitarian response that HelpAge set up. We are a small organization and we have a modest response. But we essentially, I think the fact that we were on the ground really helped us. That we are working with local organizations has really helped us. And we have all our team in Lebanon is a national team, so they're all Lebanese there. And we have been working very closely anyway with them. So our approaches were kind of, I will mention, like covering three angles. The first one is we immediately reprogrammed our existing programs and that were going on in Lebanon, which a lot was on NCD management, on health services, on psychosocial support services. So we reprogrammed that because that was quick. We could do that, and we could easily talk to the partners to manage that. We also initiated new programs, which are again very modest because a lot of it depends on funding. And we are not the likes of other bigger INGOs who have a lot of money at hand. So whatever is possible, going out to the field, talking to communities, referrals that we can do, because we know which are the other organizations who are providing various services. So those small things we could easily put in place. And the third most important one is also advocating with donors, UN agencies, and other humanitarian agencies, and also with the government, the Ministry of Public Health in Lebanon, to make sure that all the people are included in the response. Now, we have a number of avenues. We have a very good relationship with the Public Health Department in Lebanon. We also are part of the cluster system in Lebanon, where we have ensured that this discourse is brought out. And the needs assessment that we conducted, I think, put us in a very good position in terms of drawing attention to the issues of older people. So I think that is critical, and that is an ongoing work, but that's important to make sure that we do not miss out on it. Two other aspects that I want to talk about is also our key purpose was, how do we ensure an outreach and to make sure that we reach out to as many people as possible. And we had existing beneficiaries, but just for some perspective, our previous project that we were working on, the locations are different than the locations that were hit by the explosion. So we had to, make sure that we work with the partners to move to these locations as well. And working with local organizations, involving them in the assessment was a big plus. It helped us in the outreach. I think it's really important. And then we framed our program based on what we have in our humanitarian approach that HelpAge has. We assess and assist. So it's not just sitting in our offices and designing programs. It's being on the ground, talking to the communities, talking to the affected people, assessing their situation, and accordingly providing the assistance that is needed. So the design of our program is largely based on, of course, our previous information, but also on the assessment that we conducted. Now, coming specifically to the interventions, I would share a couple of key ones with you without going into too much detail, because it would be good to leave some time for the question answers. But very quickly, we made sure that older people and their families received the hygiene kits and the PPE materials. It involved distribution, a lot of hygiene kits to a number of communities, because while we were talking about explosion, we did not want to forget about the COVID-19, where the number of cases were quite high. The other important intervention in reaching out to older people who were homebound, whether due to lockdown or limited mobility, this was managed with the help of volunteers. I think a very important point here, they allowed us, they made it possible for us to reach out to older people, of course, adhering to all the COVID-19 preventive measures, masks, using, etc. So helping them to get the groceries or to do their shopping or medicine or whatever their needs were. We also reached out to older people for mental health and psychosocial support. And what came to our rescue was the technology. It was amazing how immediately activities were transformed to this different mode of reaching out to older people. So phones were used, various apps were used, social media was used, Facebook was used to reach out, and it helped the older people not to feel alone, but also to address their psychosocial needs so they feel connected. So a lot of individual calls were also made where possible. But we also, some older people could use phones. Others we use we engage with the younger people in the community or the household to reach out to older people. Of course, awareness in COVID-19 continues. That is something that will go on. We use radios, phones, social media. We also use the various vans passing through the communities for the announcements. Another big thing that has come up is the cash distribution. That is part of our design, but we are looking for funding to do that because the immediate need is for cash for people to, repair their houses or address their other needs, medical needs, etc. And to address the medical needs, one more intervention that we did was to set up the mobile units, so medical mobile units. And they reach out to older people who are at home, either due to lockdown or mobility issues, and where health services were closed due to government orders or because of this situation where the health services were affected. The other thing that I think and I'll share that with you later on, is the material developed. So HelpAge developed a lot of material which was very, very useful. It includes guidance for care homes for older people, advice for communities and older people associations, advice for home carers, and guidance and advice for older people. I'm just mentioning the few. They're in English, they're in Russian, they're in Arabic as well. So I'll stop there because I think I've crossed the time limit there, but happy to respond to questions or clarity that I can bring in. Thank you.
Thank you, Samina, and thank you for, really helping us to be in the lived experience that you are and the work of HelpAge International. I want to just acknowledge Verity McGiven, who is on the line, and probably many other of your colleagues in HelpAge. Yeah. Look, there's one question that I asked you as we went into this town hall, and at the same time I encourage questions from the floor. What makes you get up in the morning? Where do you get your optimism from? You said that you've been working in this field for 20 odd years. So, what is it that keeps you out there and driving the agendas?
I will probably not say this on a public platform, but I'm also 50 plus. I know what is happening there, but I think what's more importantly wakes me up is, thinking we can't give up. It is extremely important that we do our part as individuals and as organizations, as civil society organizations, to make sure that we draw attention to the issues that are critical for the well-being of people, be that older people, women, or other vulnerable communities. And I think that sense of responsibility, and I'm not the only one, there are so many other people who work that way, who are very keen to be part of this humanitarian responses or this discourse. And I think it really is important to continue to talk about the role of civil society organizations, the very important role, the role of the government, the duty bearers, how we can work with the affected communities to hold the duty bearers accountable, and to continue that debate. Because it is fine that we talk about it, but it's really important that the affected communities talk about their issues as well. So giving them that opportunity and voice to talk to the governments, to the other UN agencies, international organizations, and sort of at a lower level with the local government people to draw attention to their issues is very powerful. So to answer your question, I think is being human and just, I always feel we can't give up. We have to try.
So yes, look, I agree. Samina, do you ever notice any tension across the generations in humanitarian settings? You know, I'm very conscious that the work of HelpAge and others really ensured that older people were actually part of the UN humanitarian response, the publication. But it to my understanding, it wasn't in the first version. So,
Yes.
and I think that's a key for advocacy. You know, HelpAge and others ensure that those that develop the document, first of all, older people were not present, and then the second version that they weren't, which was critical, which means that education and awareness is constant. But do you ever experience or observe tension across generations in your work?
Of course we do. And I think that's why the third pillar is very critical for us, advocacy, to make sure we talk about inclusion. I think that is so critical. And I think this, for me, the sad part is that we have been doing this work for so many years. I personally have been in the field for 23 years, yet I come across every time situation where there is so much exclusion, sorry. You know, whether it's about disabilities, whether it's about older people, whether it's about, female-headed households. So there is that tension, and I understand, the humanitarian organizations are overwhelmed. I understand there are so many emergencies happening. But for that reason, we need to make sure that we continue to advocate for the inclusion of the most vulnerable communities. In our case, we are talking about older people as well. But also to work side by side with the governments on these policies and practices and their plans, which are more inclusive. So the tension will always be there, I think, because it's not a simple issue. But for that particular reason, we need to continue to work on it.
You know, Samina, I think I'd like to sort of talk about the elephant in the room for a minute, and that's money and funding. And it's not often that we talk about this. You know, IFA really is built on project funding, which means that we make proposals for particular projects and we get funded for that. Now, you know, similarly, in a humanitarian disaster, such as the explosion or, and COVID, there are lots of donations. But when we talk about the specific work of HelpAge International, sometimes you need to be moving money, in all sorts of situations. Is that problematic? And what is the best options for organisations such as HelpAge? You've got a captivated audience here. So I think it's important that we talk about this.
I am really appreciative that you brought this up. I wasn't aware as we were going to talk about it, because this is so critical. I mean, before, I used to think, when I was very young in this field, this is not the responsibility of NGOs, to do something about this, and the government, the state is responsible. But it's a different world we live in. It's everybody's responsibility in their own right to do something about it. And the way aid business works, it is very difficult to access. I have to say, it is influenced by politics. It is influenced by, where the goodwill is, the relationships are, how we make sure that the attention, for example, a lot of aid comes from the Western countries. What noise are we making there to draw attention of public who is not aware what's happening on the ground? How do we draw their attention to contribute to the funding? But also, how much are we actually working with the affected communities and the states, the countries in war, to bring in peace there, so they don't need that support. But going back particularly to the issue of funding, it is a very important issue and a problem for us, because it is difficult to channel money from donors directly to it, because it's not an issue for a lot of them. That's why when we talk about advocacy, we are not only talking about with the government or other, we're talking about international humanitarian organizations, we're talking about UN agencies, and we are talking about donors as well. So it's actually the people in business, in the humanitarian sector, who also needs to be influenced. And how we can go about it, I think it's really important to first recognize that this is an issue. And funding is an issue, older people issue is an, ageism is an, something that needs attention. And there should be a dedicated fund allocated within the UN agencies, within the bigger donors such as DFID and GAC and others, who should make sure that smaller outfits like HelpAge do access those funds to be able to respond. I also feel, as a small organization, we are not going to change the world, but we are definitely going to demonstrate and draw attention to the issue using these funds, one, to respond to the immediate needs, but also to demonstrate how we can do better with this. So it's extremely important to allocate money for this, and the donors needs to take that into consideration. We are also told, the money is going through OCHA. Yes, it is going through OCHA and through the cluster system, but not everybody is plugged into this. And not, there is a different dynamic there that I don't want to go into, but how decisions are made there, it has a different way of doing things. So it's extremely important to consider, the funding requirements of organizations like HelpAge for donors.
And other civil society organizations.
And other civil society organizations, absolutely.
I do want to acknowledge Edward's comment that UNFPA is currently discussing a global MOU in collaboration framework with HelpAge.
Yes,
so thank you, UNFPA, which is critically important. Could I ask Francis to come forward and ask Samina the question? Francis?
Hi. So I should have the camera on. It didn't. Actually, hi, good morning. Thank you. I was actually making a comment because I represent IFA at the United Nations in New York, and I often see governments talking about collaboration with NGOs. And I always make my little spiel when I have the opportunity to say that NGOs have had a history of knowing who is left behind. They have always stepped in and reached out when government policies have failed. NGOs do crucial work and should be at the table to develop policy and participate in decision-making by governments. Unfortunately, many governments view NGOs only as watchdogs instead of also as partners and implementers. And at the policy level, we see this all the time. So in terms of at the UN, it's difficult to be in the room when negotiations are taking place, for instance, on global policy. And I was just wondering how at the local level, how much involvement or welcome NGOs receive from governments and how you can participate in decision making. Thank you.
That's a great question, Francis. Thank you. I thought you were going to ask a question about older women, Francis. All right, Samina, your response?
Yeah, very quickly. I think you, Francis, thank you very much for the question. You have rightly pointed out that in a lot of cases, NGOs are seen as, watchdogs or somebody who is against the government. I think we are partly responsible for creating that image in some countries. But at the same time, I think, NGO people, they have learned over time that we need to work with the governments. And we need to, appear as, understanding their problems and try and work together with them. I think that barrier is still there, but it has reduced. Another, and you might find that funny, I'm using that word, emergencies sometimes do magic as well. And the magic is that they know very well their own capacity at the government level that they are unable to deliver. And that's why they open up and receive NGOs open-heartedly. And for example, we were contacted by the Ministry of Public Health at the back of our needs assessment and had a half-an-hour chat with us, wanted to use our data, wants to work together with us. So it's how also I think we approach them as well. It's responsibility at both ends. Criticizing the government only without providing solutions upset them. And we need to understand that very well to be able to work together with them. But generally, yes, they are seen as watchdogs. But I have to say, I feel like we need to approach this slightly differently. We need to be seen as, somebody who is on their side and understanding their problem and work together with them rather than only criticizing.
So I'm going to ask Eileen to come forward in a moment, but I just want to pick up on something that you said and one of my concerns. You said something about emergencies sometimes do magic. What I am most concerned about is the magic of COVID is actually going to start becoming not so shiny. So if we are living with COVID for the next 2 years, which is quite likely, then the shininess of this problem actually doesn't then attract the attention that, so, the disaster, and we see it in countries that you've worked with, Samina, there are man-made and natural disasters in many of those countries that just become the normal rather than, an urgent situation. So how do you do, I'll put the question to you and then ask Eileen to come forward, but how can we deal with that? So I'll hold it there. Eileen, welcome from Dublin. Where are you?
I'm up on top of, thank you very much for all of your work on behalf of humans. My question is very similar to what you've been pointing out. NGOs are needed in times of emergency. The same happened in Ireland. But how can the organisations maximise in this situation to sustain it into the future? Any key things that we can work towards? Thank you.
Thanks, Eileen. So over to you, Samina.
Thank you very much. I think on the first point, the term that we have been hearing a lot is, the new normal. And we need to ensure it is not the new normal. It should not be normal for us to live like this. And therefore, it goes to the debate of how we can work with the government on the policies, because the long-term policies, the state responsibility, the constitutional responsibility towards their people is something we need to continue to work with on the government, to hold them accountable, to assess them, to bring out the gaps in it. So that work, I think the civil society and the NGOs and other, community members, they need to continue to engage in that discourse. So it doesn't remain a normal. We need to learn from this COVID-19 emergency and highlight the issue, the gaps and how we can work on them if such emergencies, God forbid, happens again. In terms of, the question that my colleague asked regarding what we can do, I think, to me, it's really important that we try and work together with other organizations. We try and And individually, things are not possible. So it's important to work together with other organizations, to join hands, to have more coordinated responses and talk about the issues. Because it's critical that we engage with the governments, with the duty bearers, and together with them, work on the policies that are required to address the issues. In Jordan and in Lebanon, we have been approached by the concerned ministries who have worked on the national policy for older people to work with them, to launch the policies, to work on the implementation. So I think I always feel as NGOs, as international organizations, as civil society organizations, somewhere down the line, there was this thing about, we would only protest. I think we also need to look at our approach and how we can work together and be less confrontational, but still raise the issues and work together on those issues.
Mm. And also in the context of rights, many of the countries that you work in and we work in, the rights of older people are certainly not protected, in the legal framework. And that's why the work of GARAP, the Global Alliance for the Rights of Older People, and also, the UN Open-Ended Working Group on Aging at the UN is so critically important. I think we've also got to recognise that we're in this almost kind of space where, the Decade of Healthy Aging will be launched within the next 12 months. And what does that mean to us in the context of humanitarian disasters, as well as the immunisation strategy? So there's a number of different platforms that we need to start connecting. So I'm going to ask Cynthia Stewart, and Cynthia is the main representative for IFA at the United Nations in New York. So Cynthia, welcome.
Thank you. And thank you, Samina. That was really very fascinating. And I was thinking about how we've all during this pandemic been much more using the technology, but the digital divide is so present, particularly for older persons. But do you see an opportunity for more public-private collaboration to enhance in the countries where it's not as accessible, that we might really tackle this issue of the digital divide and be more inclusive of older persons at the local level?
Thank you very much, Cynthia. I briefly mentioned how technology helped us and how we were amazed at how quickly the staff picked up the issue and ran with it in terms of reaching out to people. Your question about the digital divide and the role of public-private partnership, absolutely they can play a role. The corporate social responsibility aspect, that is something, a lot of organizations are interested in. I think it's also up to us how we engage with them and make them aware of what is the issue and how they can contribute to it in these countries where it is such an issue. In general, just having an internet is an issue. A regular, stable internet is an issue. Phone line is an issue. They definitely have a role to play, but we also need to take responsibility to engage them in this discourse. I mean, if I look at some of the examples I remember from, I think, Kenya and also here, how the cash distribution happens using phone. So there are, I think, companies who are interested, but we also need to do a lot more to make it easier for them to understand how they can contribute and demonstrate and share ideas with them. But there's definitely space for it that will then help to actually make sure that we include older people and they benefit more from everything else that is going on.
So Samina, I'm going to go back to, money again, just for a minute, because, you talked about, the aid business, and I think that's an interesting word. What we're also very concerned about is in times of austerity, if we're actually looking at, high and middle income countries, who are often the main donors, they are also moving into a period of significant austerity. And so the funds for aid, but also the funds for health promotion, prevention strategies, e.g. vaccines, is also going to mean that there's prioritization. You know, how do you in your work, and I'll use the provocative word fight, and you talk about partnerships, but when is it that you really say older people can't be left behind? So, you know, how can you get that message across?
I think, I mean, you've picked up a very critical point, which is what happened in this pandemic. You know, the countries who used to provide assistance, they were themselves hit. And now, and it's not a hit now, it's a long-term hit in terms of the economic situation and the austerity measures, the focus on developing vaccine and the money required for that. I think for us to continue to fight for it, you know, rests in the work that we do in terms of how much we talk about our work, how much we share our work, how much we also highlight the fact that we understand that the Western countries who used to provide funding are affected. They have austerity issues, yet they are, in many of them are in the capacity to provide assistance. So someone, you know, not to name the names, country saying, I'm not going to give money to WHO for XYZ reason. Why? So I feel there is still capacity to work with the governments to keep pushing for it, keep fighting for it, keep advocating for it, but also at the same time work with the governments that, you know, in the countries that we work in, to make sure that they also prioritize this. They also provide, you know, get their priorities right. And instead of spending a lot of money on something which is not useful, to think about the basic needs of people. So to me, it's basically working with all actors, you know, to work with the governments that who used to provide assistance, but also with the governments where we work to ensure that they get their priorities right. But how we do it is to continuously advocate, to share with them, you know, what we do, to engage them. I think stories from the ground really matters, but also facts and figures. So analysis, assessments, you know, make it easier, break it down for them, and make sure that we continue that together with other civil society organizations.
Okay, so we've got two more questions. One that came in on Facebook, and it's about what are the data sets available on Arab region on COVID in aging populations? And then I go to Dr. Nagenda. Dr. Nagenda, are you with us this morning? Would you like to come forward and ask your question?
Yeah, good afternoon.
Good afternoon.
Well, the question I have is that there's a lot of discussion about how government and the NGOs act or interact. And I feel that, you know, we have for long neglected the need for really organizing the communities with whom that we are working in trying to really get them to take the responsibility of, for instance, you know, when a disaster strikes, the first people who are there are, you know, the leaders or the people in that particular community. Like in India, we have, say, the Gram Panchayat, the village, you know, Panchayat, which should really be the ones that takes up immediate, you know, response. So my feeling is that we have not done enough in terms of the NGO sectors, for instance. Very often they're also looked upon as basically contractors of the government, implementing government projects. So I think we need to really move away from that and maybe really help communities to take that responsibility of doing their plans and implementing their programs. And where we are facilitating, bringing in things that are not available locally. Today, the way we operate, we tend to undermine what is available locally and think we should and can do everything. So I think this attitude and approach needs to be really reconsidered and thought about more seriously.
Thank you very much, Dr. Nagenda. So over to you, Samina.
Thank you very much. I'll first respond to Dr. Nagenda's concern. I think it can be a bit of a generalization because not INGOs are building their, or local NGOs are building their work from the ground. You know, they work very closely with the communities. I think what is very important is also to work with the local organizations, the CBOs, the loose groups that we have, whether it's the older people groups or women groups, to work with them to help them understand what are the government policies, who are these duty bearers, and how can we hold them accountable. And that is something that is part and parcel of our work and many other NGOs' work. So I think depending on the forum we are in, we wouldn't go into the deeper, sort of, talk about how we work with the communities. But we do work with the communities, and which the voice work that I mentioned is basically to work with the communities to help them, bring out their issues and talk about their issues and represent their issues as well with the duty bearers. I would certainly say it needs to be done more. It needs to be strengthened. So that bridge that is required between the duty bearers and the communities, that is the role that NGOs can play. So we can certainly do it more, but it is happening and engaging the communities to take up that responsibility. Sorry, Jane, I missed your previous question on
all right. All right. It's hard to keep up with them all. What are the data sets available on the Arab region in COVID in the aging populations? Because there's people on Facebook live stream that are interested in learning more about the Help Age programs and initiatives in the Middle East region.
Sorry, the word data set, I didn't catch that.
Data set, yeah. Are there any data sets that Help Age has in that region?
Absolutely, absolutely. So there is work going on. I think UNFA and others are doing work that is reviewing, the various policy documents, etc. But there are also a lot of assessments available on our website. I will also be sharing the links with you. In the countries that we work in Eastern Europe and in Middle East, we certainly have done most recently some assessments. And though that data obviously is not looking at a huge, sample, but it's a representative sample that will give you an idea of what is there. So I would recommend going to Help Age website, but we will also share the link with you.
Look, thank you. And as we wrap up, Samina, I'm going to come back to you in a moment and ask you for your takeaway messages for the town hall participants. I thank you all for being with us today. Some of the thoughts that I've had in this town hall is that, Help Age is a phenomenal NGO that works on the ground in the heart of some of the most difficult situations. So I want to acknowledge Justin Derbyshire's leadership as CEO and the board and people on who are at the town hall from Help Age, as I said, Verity, Samina and others. But what it really speaks to is the bandwidth. The bandwidth of Help Age is stretched. The bandwidth of IFA is stretched in terms of, understanding how we can drive an agenda. The way that we do it is really to build bridges and strengthen partnerships across sectors and across disciplines. And Samina, you mentioned, non-communicable diseases, as one. What you've also spoken to is the critical importance of being part of a solution and not getting pulled into the blame game, because that is neither useful, meaningful, nor is it productive. And so I think we need to take away that money is an issue. Restricted money is an issue. So what is the aid business doing? Also that older people are part of community, not separate to. And so the value and the rights of older people are equal as important as someone who is in the paid workforce. So Samina, I'm going to hand it over to you, thanking my colleagues from IFA on the call, most particularly Andra Stanku, who is the project lead, and also Chesley Ryder, communications manager, who is nothing short of phenomenal. So Samina, over to you to wrap up.
Thank you very much, Dr. I think, I mean, you have summed it up in terms of the last key points that you made. But just to add to that, some of the things that I feel we really need to think about, you know, leaving this conversation is to think about, you know, how COVID-19 exposed the inadequacies and weaknesses of the health systems and how unprepared, we all know this, so I'm not going to repeat the whole thing, they were to deal with emergencies of such nature. Even developed countries could not cope, so let alone the countries that we work in, which are in trouble anyway. It is so important to moving forward to focus on this element and strengthen the health systems, both in developed countries and developing countries, to be able to have the capacity to respond to such emergencies if they so happen again. The other way, I think the other thing that I want to mention is, which one of our colleagues also mentioned, is the whole aspect of technology and how we can involve technology to make sure that we reach out to older people, that we ensure that they are included in this new age where technology is everything. How we work with the private sector, with the government, and other organizations who are working on these issues to reduce the divide that is there and ensure that, you know, older people have access to technology and they benefit, for example, from telemedicine. Why not? And I think it will, I was thinking of COVID-19 and how they're not supposed to go out. If the telemedicine was active, it would have done wonders. And so to make sure that we engage the right people, the private sector, the governments, and have proper plans in place to take this forward, because it will contribute to the inclusion of older people in this cause. Also, I would like to highlight other important element, which is very much at the community level, is the role of volunteers. I think it is so critical to acknowledge the wonders that they did in reaching out to people. And that takes us back to what Dr. Nagendra was saying around, you know, the community work. So in working with the communities, working with the volunteers from those communities, affected communities, to engage them in the response is quite critical. It's not always Samina or XYZ coming from outside doing the job. It's actually working with the local people and building their capacity, and they already have the capacity in a lot of cases. They know a lot more than we do. So, but how we engage them constructively in the responses and build their capacity, it allowed us immensely to reach out to as many people as we could. The second last point that I want to touch upon is how important it is to work on peace initiatives in all these countries suffering from war and conflict for years now. I think that is an important element that needs to be thought about, taken seriously, and work with the systems, you know, to make sure that they need to have strong systems, they need to have capable human resources and conducive environment to respond to any emergency. And the point that you mentioned earlier in terms of, you know, the austerity situation there, if these governments were strong enough, then why would we look outside? So I think it's really important to look at that angle, because all of that will enable them. If there is a peaceful environment, there is a responsible government, there is accountability, one would hope that it will respond to the needs of people. Okay. So I think it's quite critical there. And my last point, last but not the least, is the whole discourse on ageism. I think it needs to be mainstreamed. It needs to be talked about more. The current crisis has once more highlighted how critical it is that it to change the narrative around ageism, to engage with the governments. I mean, it's interesting I recently was looking at some data and found out that Iraq had a very good, retirement system and very good policies around retirement. What happened to it? So there are some good things in place, but how we pick up those and how we can engage with the government as contributors, as collaborators, not only as somebody sitting outside criticizing, and work together with them. So that would be sort of my last, takeaway message, that we work together to work on the issue of ageism and try to change the narrative by working together on it.
Well, look, thank you very much for being in conversation with us today.